Hello, everyone. Welcome back to Brain Tumour Foundation of Canada's webinar series, our fall webinar series. I'm Janik Goryeb, and I am the Senior Health Education Engagement Specialist with Brain Tumour Foundation of Canada. If you can let me know in the chat if everybody can hear me okay, and maybe also let me know where you are calling in from. Perfect. Thank you, Karen. Let us know in the chat where you are signed in from. Perfect. Give you guys a minute to do that. We are super excited to have Ryan Fraser with us today, author of Driven by Purpose. And you're going to learn more about his book a little bit later. And his presentation is going to be about how everyday people can make big impacts on brain tumor research and support programs for their estates. Now, I know everybody's expecting to have two presenters today. Jamie Bradstreet was originally scheduled to present his personal story of hope. He is not feeling well as he's going through treatment, and he wanted to send his best wishes to everybody, but we're hoping maybe down the road we will re-record or record that presentation so you can get his personal story of hope and his experiences as well. But before we get into that, we want to say a big thank you to Novacure, who is one of our sponsors this year for the entire webinar series, our 2022 educational webinar series. So big thank you to Novacure. And also just a few announcements. Coming up on Wednesday, November 2nd, we are going to be hosting a very creative event called Pachekcha. Some people call it Pechakucha, but it's pronounced Pachekcha, which means chit chat in Japanese. And basically, it means this style of presentation, I should say, is known as a 20 by 20 or a 10 by 20. And basically what that means is that presenters provide a very short, concise presentation on a topic that's of interest to them. And they have either 10 slides or 20 slides that are all pictures. So there's no text, not like your typical PowerPoint presentation. And each slide automatically advances every 20 seconds. So if somebody does a 20 by 20, it's a 6 minute 40 second presentation. If it's a 10 by 20, then it is a lot shorter, or half that length. And so we are reaching out to our community to see if anybody would be interested in presenting at our Pachekcha event on November 2nd. We are looking for survivors. We are looking for patients, survivors, thrivers, caregivers, healthcare professionals, researchers, and so on. And we would love to have you join the event. We are encouraging people to present on topics that are of interest to them. Doesn't have to be brain tumor related, but it can be. And so reach out to me for more information and we will go from there. Awesome. Perfect. If I could have, I'm just going to mute. There we go. Perfect. And so the next announcement we have is in regards to our Super Kids program. So this is a program that we launched during the pandemic. It is an educational program for teachers and parents to access. There are a plethora of lesson plans that can be downloaded from kindergarten to grade 12. And we're really encouraging parents, so if there's parents on the line or watching this at a later date, to please let your elementary school and high school teachers know that that we have this program and that these lesson plans are available to download at any time throughout the year, and really is an opportunity to teach kids and teenagers about the brain, about brain tumors, about brain health, and lots of really great fun worksheets and various lessons that can be downloaded. So we really encourage you to make sure that as your teachers in your life know about this. And of course, parents can access this as well. And so just a few reminders, or actually before the reminders, a reminder that we have a brand new app that we launched this year that you can download for free. And it's a great way to access our handbooks, support information, and other programs and services that we offer. You can access our handbooks as well, which is super awesome. And we are also developing a peer-to-peer program. So look out for that as well. And just a few reminders that this webinar is being recorded, so everybody is muted automatically. You'll see there's a section for a chat as well as Q&A. And so the chat section is just kind of like the general chat, general comments. But if you have a question for Ryan, please put it in the Q&A, and then we will take up those questions at the end of his presentation. And anyone who stays until the end of the webinar will be eligible to win a door prize. And this month's door prize is this awesome Brain Tumour Foundation of Canada bag. And so before I introduce Ryan, I'm just going to do a couple of poll questions for you. See who's on the line with us today. The first question is, have you attended a Brain Tumour Foundation of Canada webinar in the past? Yes or no? Give everybody a moment to answer that. Great. So yeah, it's pretty even, 50-50. All right, for those of you who are new, welcome to your very first Brain Tumour Foundation of Canada webinar. And the second question we have right now is, who was online with us today? So are you a patient, survivor, or thriver, a primary caregiver, a family member or friend, a healthcare professional, a volunteer for Brain Tumour Foundation of Canada? And I've added staff member as a new option now, and or other. Give everyone a moment to answer that. And my colleague Karen has added to the chat section some links about those programs that I just mentioned. So thank you so much, Karen, for doing that for us. So if you're interested in learning more about the Pachecha presentation event or the Super Kids program, you can click on those links. Perfect. So we have a nice mix of people, just so Ryan knows. We have about 44% are patient survivors and thrivers, 6% caregivers, 22% family members and friends, 11% healthcare professionals, and the rest are volunteers and staff members. Wonderful. Okay, so Ryan, I'm going to stop sharing my screen in a second. I'll have you pop up online here. Hello, Ryan. Thank you for joining us.
Thanks for having us. For having me. There's
only one. There's only one of you. Perfect. So before I stop sharing my screen, just want to do a quick intro for our wonderful presenter, Ryan Fraser, who is a nationally known financial planner and philanthropy expert with an extensive background as a leader, volunteer, and founder of many charities. He is the author of the book Driven by Purpose, 32 Remarkable Stories about Growing Your Wealth and Leaving a Transformational Legacy. Most of Ryan's clients he works with want to really make a charitable giving and philanthropy an important part of their financial and estate planning. But they don't always know the best way to go about it. So in his book and through his presentation today, Ryan is going to talk to us about financial and estate concepts in a practical and entertaining way. And I'm sure he will share lots of good tidbits for us. I know that this is a topic that might not be very well known to a lot of people. So for those of you who are online, we are very, very happy that you are joining us today and to learn. And thank you again, Ryan, for joining us. And the floor is yours, so to speak.
Thank you. Well, let me get my screen sharing on. Well, good afternoon, everyone, or good morning, depending on what part of the country you're joining us from today. It's a real pleasure for me to speak with you today. As I'll explain in the next couple of slides, I have a really lengthy and long connection to Brain Tumour Foundation of Canada, and I see a few familiar names and friends out there on the list today. So thank you for attending, all of you. I do a lot of these talks, and it's always a pleasure, but I'd like to start them all just by sharing with you why I'm so passionate about the kind of work that I do in the intersection of philanthropy and estate and financial planning. So I don't know how many people remember 1981, but this is what I looked like in 1981 with my velour shirt my mom made for me and my bowl haircut. I'm pretty sure I got it home. I was 6 years old. But something really remarkable happened in philanthropy in 1981 and charities. And I'm sure many of you would recognize this young man who was about 12, 13 years older than I was, Terry Fox, of course, who did his run across Canada. And as it turns out, he ran a few kilometers away from my house. And one of my earliest memories was of Terry Fox running, and all of us in class watching this on TV as he ran just a few kilometers away from my school. And we were sitting there, it was either kindergarten or grade 1. And I remember for the first time, I realized there was a world bigger than myself, because, you know, at 6 years old, most of us are very much thinking about ourselves and not about the world around us. And there wouldn't be very many of these great organizations like Brain Tumour Foundation of Canada if we didn't start thinking of the world as bigger than ourselves. And I'm forever grateful to that moment, because that really started me down the path that you see today. And in 2021, I met this lovely group of folks. Everyone in this picture, except the younger gentleman in the back with the goatee, were World War II radar veterans. And in the Second World War, we had 6,000 Canadians drawn from every walk of life, put in a project more secret than the search for the atomic bomb. They were sent all around the world, and they couldn't talk about it until 1991, if you can imagine. And my buddy Fred Bates, who you see there cutting the ribbon with his walker, was a force in nature. He got 8 of us together, and we were the founding board of the museum. And the vets were, you know, under a tight timeline. Fred, I think, was 78 or 80 in this picture. This was from when we actually opened the doors in 2003. And it was just a remarkable thing to start a charity from scratch. And I've always felt a kinship with founders of charities, because you find a void, just like Brain Tumour was a void, right? Brain tumor research before the foundation here in Canada. And it's really important to fill those. And so for those vets, this was fantastic. Unfortunately, virtually all of our vets have passed away. The few remaining ones now are probably in their early hundreds. Remarkable place. If you're here in London, you can go visit it still. It's now on Crumlin Side Road with the 427 Air Force Wing just by the airport. Worth a visit. I probably unfortunately won't get to meet a vet anymore, but it's an amazing story. We actually filed our charitable registration papers, believe it or not, the day before 9/11. So it's quite an adventure to get a charity up and going, especially with military theme at that point. A few years later was my intro to Brain Tumour Foundation. And I show this picture. It's funny how everything comes full circle. This is my wife taking a selfie of myself and our good buddy, Stefan, who's a roommate to both of us. Steph's like an adopted brother to me. He's an honorary uncle to my kids. And my wife and I had actually, through confluence events, each been his roommate successively, not at the same time throughout university. And I belong to an organization called Canadian Association of Gift Planners, which is an organization for financial advisors, accountants, lawyers, and charity people to get together and talk about estates and how we give through our estates and how to do it the right way, because it can get very technical and complicated. And an amazing confluence of events. It was late 2006, and some of you may remember Susan Relicon, who's now retired, who used to be development director for Brain Tumour Foundation. Sue was sitting at a table. She was brand new on the job, had just taken over, and she was trying to twist my arm at that breakfast meeting to join this committee on estate giving and for Brain Tumour. And I did the I'll get back to you. I'll think about it, fully intending to politely say no. And I got home, and at 5 o'clock that evening, Stefan called Bridget and I and said, Mom has lost control of her left arm. Her left face is numb. They think it's a brain tumor. And sometimes the universe sends you a very timely message. And that was the start for me. I called Sue the next morning and I said, okay, I'm in, but here's the crazy story that happened. And there I was, and spent the next 12 or 13 years volunteering for Brain Tumour on that committee and a few others. So I've had a long association, and it's just really a delight to be here today. But I wanted to share that with you because I think it's important to understand when we're talking about all these fun things like death, destruction, and taxes that we're going to talk about today, and the ways that we can support the charities that we love. I just want you to know how close Brain Tumour Foundation is to my heart, and you'll see this come up a number of times throughout the talk today. All right, so this is the look that most people give me when I say I'm going to talk about financial tax and estate planning, and it's usually a blank stare and your eyes glaze over. And I really don't want that to be the situation today, because we're going to try to keep this as entertaining and informative as we can. And if you have questions as you go, I'm going to get you to hold your questions to the end, but I'm going to do my best at the end of the talk today, about half an hour, to answer some of those questions. I just want everyone to bear in mind, though, please, I'm based here in Ontario, and I'm most familiar with the laws in Ontario. Some of these things may change depending on the province that you're in. So if you're in a different province than Ontario, I'll do my best to help you out. But you may want to check with someone with more knowledge in terms of the estate rules in your province, because here in Canada, estate rules are on a provincial and territorial basis rather than on a federal basis for the most part, even though tax on our estate is actually handled primarily at the federal level. Now, the thing is, we can all do great things if we're inspired to act. And so the story behind my book and the story behind the talk today is, often you come to talks like this and they're going to be very, very technical. And sometimes, I love this quote by Jean-Luc Godard. Sometimes reality is too complex. Stories give it form. And that quote was actually the birth of my book, Driven by Purpose. I really struggled over the years doing these talks for organizations and finding people to be overwhelmed because we tend to talk about tax and technical details. And the reality is, most of us, unless we're trained in that area, that makes our eyes glaze over and we tend to fall asleep and snore a lot. So I wanted to find a way to tell people stories about great things that other people have done, sometimes famous people, sometimes people you've never heard of. And so that was the birth of my book. And the publisher, Karen Millen, and I are really proud of what we were able to do with that. The book's website is drivenbypurpose.ca, and you can check out some information. There's some sample chapters and audio recording of one of the chapters in the book and give you a flavor for it. I'm going to share some of those stories today that are in the book, and they're stories of action and impact with the smallest amount possible of math and tax, because I know that's not everybody's thing. If you're interested in math and tax, I'm more than happy to reach out and can send you all kinds of detail on that, but I find it's a little overwhelming for most people. But the very first story in the book, and one of the reasons I wanted to write this book is I've been very fortunate to meet some incredible people over the years who've been able to do some amazing things with their own financial estate and charitable planning. And, Sammy, the title of the chapter is The Man Who Won It All and Gave It Away. I met Sammy in his later years, and about 5 years before I met him, he'd actually won the 649. It was a good chunk of change at the time. He was a really, really incredible man. He was an immigrant who'd come to Canada with nothing. He'd smuggled himself here on a cargo ship. His only family was his wife and his 2 kids, and he'd eked out a living for himself. And then in his probably late 50s, early 60s, he won the lottery. And rather than going out and spending it on all those things that one might think, the cars, the planes, the vacations, and all of that, he actually went out and he went back to a little village that he grew up in across the ocean. And in a very remarkable gift, he paid for the installation of a sewer system, because where he grew up, there were in fact, virtually no working toilets, no sanitary system. And he went back to that village. And he spent some of those millions to make sure that everyone he'd grown up with, even though he'd left at quite a young age, had a working sanitary system. And it was such an incredible act of charity. And it was an act of charity where there wasn't even a tax receipt involved, because that's not something we can necessarily issue a tax receipt for in Canada. But he did it out of the goodness of his heart. And really remarkable man. And, I remember he said to me once, when I won the lottery, the bank treated me like a god. And then through he had lent some friends some money. It didn't go well. The bank foreclosed on the business that the friend was trying to start up, and he lost all of his money. He said, and they treated me like dirt after. And he goes, but that doesn't bother me, because the money was never mine. He goes, it just treated me that someone would treat another human being differently based on what access to resources they had. And that has just really stuck with me. It was such an inspiration to me, and I made him the first chapter in the book. So let's talk about different ways that we can give. And we're going to make sure you're still awake. I'm going to get Janik to throw up a poll for me. So here's my question for you. Yes or no? Did the pandemic make you rethink your own estate plans? So let's see what you guys see. Every time I've done a talk for the last year or two, I throw this one up. And I find it a fascinating question. So we'll see if you guys are the same as all the other talks that I've done the last couple of years.
That's a great question, Ryan. Everybody's just answering right now. Give everybody another second.
All right, we got 5 or 6 of you to go. Don't worry, we're not recording this. We're just seeing this in aggregate, but it's pretty fascinating. So the numbers that I'm seeing here are about 2/3 of people said yes, and about 1/3 said no, and that's bang on. We see about a 60-40 split when I do talks for different organizations over the last year. And I think, many of us, we don't like to think about our own demise, right? It's a very uncomfortable topic, but the pandemic kind of threw that in our faces. And of course, if you have a loved one or you yourself have had a brain tumor, that also throws it in your face pretty quickly, right? We have to look at our own mortality and sometimes, come to grips and face things that we wouldn't have otherwise done. What I want you to remember when it comes to your will, if you don't have a will, Your province of residence, those rules determine what happened to your stuff, and they've got a formula. And that formula, at least here in Ontario, has just been recently revamped. So I can't give you all the details because I'm not familiar with the new rules that just came in the last couple of months to the same extent I was the old ones. But basically here in Ontario, the first several $100,000 goes to your spouse. If you've got kids, money beyond that is split between spouse and kids. And then there's a whole family lineage that it goes through, so that if you don't have kids or a spouse, could end up going to relatives that maybe you don't want to support. So really, really, really important. Please, 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 if you don't have a will, please go out and make sure that you get your will done. Now, both federally in the last 6 or 7 years, there's been lots of changes to how wills and estates are handled, but also in Ontario, specifically provincially, some massive changes as well. So no matter where you live in the country, if your will is more than 6 or 7 years old, I would really encourage you to dust it off, go talk to your lawyer, and get things updated, and just make sure the wording that you've got still works under some of the new estate rules, because it's really important to do this on a regular basis. Because if you lose your capacity to execute a will, so that could be through mental infirmary, could be mental health issues, could be just straight out health issues. Nobody can make changes to your will except for you, and that includes your spouse. So it's really important that we stay on top of this on a regular basis. Now, some people don't want to go and pay the money, and I do strongly recommend that if you're going to go to a lawyer, try to find a specialized estate lawyer who specializes in wills. There's lots of general practice lawyers. The example that I give, my mom and dad years ago lived in a very small rural area. There was a general practice lawyer who did everything. He did commercial law, real estate law, estates, wills, you name it, he did it. That saying, jack of all trades, master of none, was kind of the case, because in my line of work, I see a lot of wills. And while I'm not a lawyer, I've got a pretty good sense of what should or shouldn't be in there. And just an example, at the time, there was no provision that my sister or I, as powers of attorney or as estate trustees for my parents, could do anything without the other one being physically present. Well, at the time, my sister lived in Kenya. So you can imagine that would have been a little challenging for her to get a flight back to Ontario in an emergency to get something done. So make sure that you're dealing with a specialist who can think through some of those scenarios with you. And you're paying them a little bit extra because they're going to think of things that you and I never would have think of, but they do this on a regular basis. So they've seen all of the disasters. You can go out and do wills on your own. But I just saw this article a couple of days ago from Wealth Professional, which is one of my industry magazines. And the headline was, "Are do-it-yourself wills creating more inheritance conflicts?" And in the UK, one of the things that's been noticed is since the pandemic hit, a lot of people did very quick do-it-yourself wills using some of the online platforms, other things. And it's not to say that you can't do it, because those are going to help you. So what I would say is, I would advise you not to do a will kit. Some of the online will options for doing wills can be useful if your situation isn't too complex. And by complex, I mean anything other than everything's going to this person or maybe directly to my kids, and my kids have no issues, no marital issues, that. But if you've got second marriages, if you've got somebody who's got a marriage that's unstable, either you, your children, your grandchildren, you're probably going to want to get a lawyer to get involved. In the UK, there was a Freedom of Information request this year that found a 37% increase in legal challenges to wills between 2019 and 2021. Now, that doesn't mean Canada's the same, but I think it's a good indicator of a lot of people did rush in this time period to redo their wills, and there may be things in the wills in which the wording's uncertain. And in most provinces, if there's something uncertain in your will, it's not the person challenging your will who pays the legal bills, it's actually your estate. And in my book, there's one story that you'll see in particular of a family where dad wrote a deathbed will influenced by a spouse who was a second spouse, married quite near the end. The kids had a lot of concerns about undue influence. Very sad story. And at the end, most of what the kids were trying to protect in the estate wasn't actually money, it was artwork. And at the end of the day, most of the artwork had to be sold to pay the legal bills. You've got to be really careful because you're not going to be around to express your wishes. And so having a properly worded will to say that we want to leave money to our kids, to our family, to a charity like Brain Tumour Foundation, really important to get it right. Even something as simple as knowing the official legal name of a charity that you might name in your will and its charitable registration number can be massive, really important. Now, if you don't have a lawyer, or you don't know a lawyer who specializes in estates or in particular in anything to do with charity, the Canadian Association of Gift Planners has a wonderful Canada-wide website, which is freely available. It's called willpower.ca, and you can go there and there's a number of great tools. If you're thinking of leaving a gift to charity in your will, you'll be able to go through there, and under Learn and Plan, you'll be able to track down various financial advisors, accountants, etc., who've got some training in this area, who are members of Canadian Association Gift Planners. Under Leave a Gift, I believe you're also able to find specialized estate lawyers who've got some extra understanding on the charitable side. So at least if you don't have someone, that's a great resource at willpower.ca. Now, I want to tell you a great story that is right from the history of Brain Tumour Foundation. When I was on the fundraising committee a number of years ago, there was a guy named William Donald Nash, went by Bill. And if you scrounge the website, you're going to find a story about Bill that I'm going to share with you. But he was a small town farmer from Ingersoll, which is about half an hour down the road from London. And he made a tremendous impact. Here's Bill. He was diagnosed with a brain tumor in 1992. And he mentored many adult students who found work on his farm. And he donated a substantial portion of his estate to Brain Tumour Foundation. Why? Well, he wanted to impact and expand knowledge, and to be able to make sure that we had the next generation of researchers and doctors looking at things in the brain tumor world. And, my understanding is that from a research point of view, there's not a ton of money necessarily in brain tumor research, because it's a subset of a subset, right? We've got the big cancer bowl, but then we've got brain tumors, and relatively speaking, relatively few people have brain tumors compared to many of the other types of cancers, but of course it can be extraordinarily devastating. So over the years, that gift of his that came through his will, the organization created the William Donald Nash Brain Tumor Research Fellowships, which was to encourage and enable young clinicians and scientists to actually enter the field of research, right? So there was a gap that was identified. And what I think, as a long-term volunteer with Brain Tumor Foundation was so cool about this is, when we think of research, we often think there's going to be pharmaceuticals, there's going to be government, there's going to be other things. But, there really was this gap. And the gap, as I understood it at the time and understand it today, is we just didn't have enough people who are electing to go into brain tumor research. And of course, if you run out of researchers and scientists and doctors, well, then nothing can happen later down the line, right? And this is like planting the seed and watching it grow. And as someone who also comes from an education background like Bill did, I just think this is so cool. And here's just three from the last few years. Identifying transcriptional drivers of glioblastoma heterogeneity. I am not a research scientist. I couldn't tell you what that's about, other than it's about glioblastomas. But you'll see that there's been a bunch of these. And so, I think it's every year, every couple of years, with that gift, this guy who is a regular person, a farmer from Ingersoll, has been responsible for research and for getting these young researchers involved, most importantly, into research. So hopefully their careers now will be forever changed by this, and I'll send them on a trajectory that will help all of us who are associated with Brain Tumor Foundation and brain tumor research in general. I think it is the coolest thing. So I wanted to share that story with you and just get us thinking about what each of us can do. Because sometimes we think, oh, I'm not, I'm not the Weston family or the Asper family, of these big names. But what I love about this kind of stuff, people like you and I can do a lot of really cool things. And leaving a gift in your will, like Bill did, is a great example. And to do that, you can just go to your lawyer and say, I want to leave this, and it could be a set amount, it could be a percentage. There's all kinds of ways that you can work with your lawyer to talk about how you might want to leave a gift in your will. And it is a lovely, terrific thing to do. And as you can see in Bill's case here, it had a massive impact. Now, what if you don't want to open up your will? So say that you have done your will and you're like, well, you know what, I just did that. I don't want to go pay the lawyer to go back and open up, or maybe your situation's really complex because you have a loved one with a brain tumor or other health issues. Well, another great way that we can give is by using our RRSP or RIF. Now, if anyone on the call is from Quebec, I just want to disclose right away that my understanding is, due to some specific rules in Quebec estate laws, this is not possible. There would be a different way to do this that my Quebec colleagues, advisors or lawyers there would be able to give you a little bit more detail on. But this method does not work in Quebec. My understanding is it will work in all of the other provinces to the best of my knowledge. So what you can do, step one, whoever's got your RSP or your RIF, go request from them what's called a multiple beneficiary designation form. All it is a fancy name to say, I want to have more than one beneficiary. Now, most of us probably name our spouse if we have one as a beneficiary, or maybe our kids or family member, but you can elect to give to a charity as well. That could be for the whole amount, or it could be for a partial amount. So usually it's done as a percentage. So you could say, for example, I want to give 10% of my RIF to Brain Tumour Foundation of Canada. Please make sure you chat with them, get the official legal name, charitable registration number, so everything's written down properly on that. Really important point. But then you could have 90% going to your spouse. You could have 90% going to your kids, or you could have all of it go to your spouse, but a contingency clause that says if my spouse predeceases me, then I want it to go to one or more charities and or children. So basically you just say whatever percentage you want. And in most Canadian provinces, so if you watch my hands here, whatever the amount is that's going to the charity, your estate is going to get a tax receipt for the amount of that gift, which will cancel out almost exactly the taxes that would have been owing on the money coming out of your RSP or your RIF. And RSPs or RIFs are actually one of the most heavily taxed things in our states. So it's like $1 can go to charity, or in most provinces, something like 50 cents might go to your kids net of tax. It's a great way to make a gift. So step one, go request that form. Step two, complete the form with the charity or charities of your choice as one of the beneficiaries. Step three, return that to your financial institution. Done. As soon as you have signed it, it is legally binding in most provinces. So the great thing about this is it's very simple, it's very easy, takes effect instantly, costs you nothing. One important thing though, please be aware that it must be due to an oversight currently in CRA tax rules. If your state's going to get a tax receipt, it must be from an RSP or RIF. So if you have a account that was originally pension money, so it has an L in it, so like an LRIF, a LIRA, an LRSP, there might be a few others, but in Canada, they almost all have an L in them if they came from pension. That is not allowed. So it must be a true RIF or RSP, can be a spousal RIF, spousal RSP. As long as there's no L in the name, you should be okay to do it. Now, sometimes, especially if you go to the bank, if your investments are with the bank branch, sometimes the people at bank branches don't know that you can do this, and you might have to fight a little. We've had a couple of banks that have been a little challenging on that front. Mainly because you can't do it in Quebec. So someone just did sort of a blanket, oh, you can't do it anywhere. No, you can do it in every other province other than Quebec. So just be aware of that. Benefits here, it's super fast. There's no cost to do it or to make a change in the future. It's completely private. There's no probate or state administration tax here in Ontario or any province on the donated amount, which is great because it's bypassing your will. And it can be changed anytime as long as you still have the mental capacity to do so. So it's a really simple, really easy way. It can take you 60 seconds or less to do. Now, that was a lot of information how to do that. At the end of my talk, I'm going to give you a link where you can download PDF with that written out. So stay tuned as we go through. I want to give you another example of something really cool. And this is my friend Joan. This is chapter 26 from the book. And Joan, this was the most financial planning fun I've ever had in my life. Joan was a really neat lady. She'd come to some of the talks that I've done. She said, Ryan, I just feel like there should be something creative in my situation. She had some pretty unique circumstances. She'd retired at 55. She didn't actually need income for herself because her husband had a pension. They lived very frugally, and that pension was more than enough to support both of them. So her personal income was really low. It was around $20,000 a year. So her personal tax rate here in Ontario was only 20 cents. But here in Ontario, when you donate, the minimum charitable tax credit you get is 40 cents past the first $200 that you give. And she had a ton of money inside her RSP. You know, she was a chronic saver, and she'd done what we were all told, put your money in your RSPs. And we realized because the huge amount of RSPs and the huge amount of tax that generates in her estate, she was going to be taxed on her RSPs. Anything that was left when she passed away at 53.5% here in Ontario, which is massive. But we realized she could get money out right now, 20 cents on the dollar, and donate it and get 40 cents on the dollar in tax credit. So this is kind of cool, and you can read the chapter in the book, and I think we have a sample chapter of this one that may be up on the website so you can see it. So we've had Joan and her husband take out $12,000 a year out of her RSP, and then donate it to charity. So 6,000 of that a year was going to a life insurance policy, which would pay out when Joan and her husband passed away, which is going to be owned by the charity itself. So using Brain Tumour as an example, if you have a life insurance policy and you gift it to Brain Tumour Foundation so they become the owner, you can get a tax receipt for the premiums that you pay every year. Premiums are still due. And when you pass away, the organization, the charity, Brain Tumour in this example, would get the benefit of the policy. And in this case, that's $6,000 a year at their ages was going to generate $200,000 that was going to go to the charity that they chose to do this with. The other $6,000 a year, they were just giving to the organization in cash. And what's really cool about that is that $12,000 a year that they're giving, because they were getting a receipt because the charity owned the life insurance policy, and they're getting a receipt for the $6,000 in cash. Here in Ontario, that saved them about $4,800 a year in tax, and that let them take out about another $10,000 to $12,000 from her RSP, effectively tax-free, because she was getting 40 cents on the dollar in tax savings by giving that $12,000, but it only cost her 20 cents on the dollar to take it out. And so the cool thing is we worked it out. If she took that difference, that other $12,000 a year, and put it in her TFSA, and her husband's TFSA, because they each get $6,000 a year of TFSA room, after 10 years, Joan would have made the equivalent of $260,000 in charitable gifts, but it only cost her estate $1,300 when we ran it. So it was pretty cool. So her husband had a daughter from a previous marriage who was inheriting the estate. The daughter only ended up $1,300 worse off for Joan and her husband to have made $260,000 in gifts. 200 that'll come at their passing, and 60,000 that they gave over that 10 years. I think it's the coolest thing ever. And so did Joan. Like she danced out of my office. She goes, I feel really rich, but it's basically costing me nothing. And she still can't get over it. We're 7 years into the 10-year plan. It's gone like tickety-boo. And every year she just calls me up delighted to tell me how well it's worked. So that's a great example of being creative, depending on your tax bracket, depending on your situations. And it's two examples. So you can, if you have a RIF or an RSP and you don't need the money, you could look at taking some out and turning around and donating it in your lifetime. Make sure you get some advice from your accountant and or financial planner, because for some situations like Joan's, it works out fantastic. For some people who make between, in Ontario, about 80 and 120,000, it's not so good. It just depends on the numbers for your particular circumstance, but it's worth talking to your investment and tax professionals about it. And, for Joan, this was a win-win-win all the way around. She and I just felt fantastic about it. Now, this is my wife, Bridget, and I had to chuckle because I said to Bridget the other night, I want to throw up a picture of us, not in our usually when we take pictures of the two of us, we're out camping and we look pretty grubby. My colleague, Sarah, got married this past June, and it was the first wedding that we've been to or anywhere formal in 3 years. So here's us with our masks in the very small hall. So I thought it was kind of funny. My new formal wear includes N95 masks, apparently, at this point in time. But I want to talk about the gift that Bridget and I have made arrangements for to Brain Tumour Foundation. It's a variation on what happened with Joan. So Bridget and I have taken out a life insurance policy. And unlike Joan's example, where the charity is going to own the policy, Bridget and I own and pay for the policy now. However, we have made 5 organizations, including Brain Tumour Foundation, the beneficiaries of that policy. Because here in Canada, the Income Tax Act says, if you're the beneficiary of a policy and you're a charity, you are allowed to issue a tax receipt that the deceased person's estate can use to reduce the big tax bill at the time that they pass. And so what will happen is when Bridget and I pass away, Brain Tumour Foundation will be able to issue a tax receipt to our estate, which is here in Ontario, approximately 50 cents on the dollar that it saves in tax. So if we donate $200,000, then we would get a tax receipt that would save our kids about $100,000 in tax elsewhere in our state. And that's really cool for us because not only is the Brain Tumour Foundation better off, but so are our kids. But for us, really importantly, it's our last chance to send a message to our kids on what is important to us in life, if you think of it, right? Your will is really the last chance. We don't want to we don't want to force our kids to do anything, but we sure want them to know about those 5 organizations that are really important to us personally. And that's going to be where to do that. And they're going to remember that. And hopefully that'll encourage them to be generous in their lifetime as well. Because I like to say in our states, there are 3 possible places you can send your money. First one is Canada Revenue Agency. Second one are the charities and organizations that you want to support. And the third one is your family. And here's our 3 boys from a couple of days ago. Our oldest, Brennan, on the right, is just started aerospace engineering at Carleton University. The kids look short in this picture, but the 2 tall ones there are 6'3.5", almost my height. And I love our kids. I love the organizations I want to support. I appreciate that CRA is necessary. Now, the way the system is, if you don't do any planning, you're going to end up sending an awful lot of money to CRA. But the thing is with our system here, you can pick any 2 of these that you want to send money to. So for Bridget and I, here's the 2. We want to knock CRA out of the picture, and we've done our planning that way. And if you're creative, you can do the same kind of thing. You're not excluding your children to make a gift, or your family, or the people you love, but our system is set up because of good tax planning to be able to exclude the CRA, because our government firmly believes that charities do a better job in many areas than they do. And so our system is one of the most generous in the entire world, bar none, far more generous than our cousins to the south in the US. So I'm going to wrap up here, and so we can get into some Q&A. I want you to remember a few things from the talk. One, our government wants you to give, and they will subsidize you and your estate with tax reductions if you give. And that allows you to take CRA out of the equation and leave the organizations and the people that you love with some support. 2, there's a number of different ways that you can give. I've given you 2 or 3 examples here. There literally are about 200. But if you've seen something here today that's intriguing, I want you to go back to your lawyer, your accountant, your financial planner, your insurance person, your investment person, whomever is important to you. Go back and strike up those conversations. And if you don't have someone who can answer those, feel free to check out on that willpower.ca website. Number 3, whenever possible, work with a trained professional. You probably don't want the neurosurgeon who's going to be doing surgery for a brain tumor to write a romance novel. But I guarantee you, you don't want the romance novelist to be doing your brain surgery either. So really important here, you want to work with a trained professional in this area. Willpower.ca is a great resource nationally if you don't have someone already who's an expert in that area. Ask around, look there, make sure you're working with people who know what they're doing on the intersection of charity and philanthropy and estate planning, particularly if you have a family member with a brain tumor or other complex medical condition where they may be disabled. I strongly, strongly, strongly encourage you to make sure you get a really good quality estate lawyer who understands both the charitable side, but also in the various provinces, some of the rules around disability and inheritance are really important to know about. And finally, I want you to be smart like Joan, be kind like Sammy, and make an impact like Bill. So to help you out with that, I mentioned before my book website, drivenbypurpose.ca. If you go to that website and if you look for a section in this color about 2/3 of the way down the first page, you'll see a resources icon that you can click on. And the 60-second bequest, which is the giving from the RRSP RIF, I've got a download there that you can pull down. There's an article there if you happen to be incorporated and have a company about making gifts of securities. That was a little too much to throw into the talk today, but there's some great examples there of why that can be very beneficial to donate from your medical professional corporation or holdco or even an active company in some circumstances. And I have a newsletter that comes out once a month, usually in the first week or so of the month on the first Wednesday or Thursday. It'll be coming out a little bit later this week. You're welcome to sign up for that. We try to make the stories fun, funny at times, heartbreaking at other times, but really educational and easy to read. And there's going to be more resources that'll pop up on that tab as well. So with that, I'm going to say thank you for your attention. I'm more than happy to take some questions. I'll have Janet come back on the line. And maybe I'll stop screen sharing so we can be full-size people for you while we're doing this. The one thing that the caveat that I'll give you is there will be some questions that may be asked that to give you a proper answer, I might need to ask you some intimate details of your financial life that you may not be comfortable sharing with all the lovely people on this webinar. So there may be a few questions I'll go, I'll send you back to someone to try and get a detailed answer on that, but I'll give you the best answer that I can. And again, really important, if you're asking a question, please let me know if you're a province other than Ontario, so that I may be able to give you some better guidance if I'm aware of something that might work differently in your place of residence.
That's great. Thank you so much, Ryan. What beautiful and amazing stories that you shared. I laughed, I almost cried. Very, very heartwarming stories. So thank you for sharing those. First question is actually from Susan Marshall. Hi, Susan. For those of you who recognize that name, Susan Marshall used to be our CEO here. And her question is, thanks, Ryan. I had not thought of this designating my RRSP for an insurance policy. Does it have the same tax saving for an estate?
Yes. So whether you do it through an insurance policy or whether you do it through your RSP or RIF, the tax savings should be identical in every province. The only sort of distinction to be aware of is an insurance policy is sometimes easier to do a set amount. Whereas when you donate from your RSP or RIF, the only way to do it is really as a percentage, because you don't know what the value is going to be in the future. Whereas it's possible to have an insurance policy for a flat amount that doesn't change. So, for a flat 10,000 or 50,000 or 100,000, your RSP or RIF could be zero at some point, or it could be $1 million. And there's not necessarily, any way to work that out. So really the difference for most people is what kind of gift. Is it a set amount? Is it a residual amount? But the actual tax implications, per dollar given are identical.
Okay, great. Thank you. Another question is willpower.ca. Does that have information for Quebec as well? I imagine it's national.
Yes, it is. So there will be notaries, a little bit different than lawyers here in the other provinces. So there'll be notaries that are there, as well as I have a number of colleagues who do similar work that I do in Montreal and other areas that you can check into. Most of what is up there is pretty generic, so it should work in any province. And I believe that CAGP has, made some notes for a couple things like the RIF. The RIF one is really the big one, the RIF and RSP designation I'm aware of that has to be different. But there are some other issues, like, for example, life insurance policies in Quebec. If you named your spouse as a beneficiary, your spouse actually has to sign off on any changes made to the beneficiary. So again, if you had an incapable spouse, you may not be able to change that to a gift to charity, or some of it as a gift to charity, because if your spouse is incapable of signing off, and that policy was originally Quebec policy, spouses have certain rights that are required for them to sign off. And I'm not aware of how you might get around that, but that's another sort of good example of where Quebec's a little different than the other provinces.
Great, thank you, Ryan. There's no other questions that have come through, but if anybody thinks of any questions after the webinar, feel free to email myself or Ryan, and I can get you connected. Oh no, that's not a question. Okay, great. Just a couple comments that came up. Marion says that she realizes she needs to redo her will. Karen says, very interesting. Thank you, Ryan. And Sarah says, excellent presentation. Really made an often complex and scary topic much more approachable and easy to understand. I agree, Sarah. And Susan Marshall says, thank you so much, Ryan, for sharing your stories and examples of what others have done to make a difference. I need to revisit my will too. So yes, I think that there's going to be a lot of us who are going to be revisiting our wills. The last time and the only time I did my will was actually the year that I moved to Prague, Czech Republic in 2007. So I think
and just as a warning, and this has recently changed in Ontario, but in a number of provinces, if you have a will and you get married, and this was true here in Ontario up until the last 6 or 7 months, your will is automatically invalidated. Okay. So just note some of those differences. And separation, for example, or divorce didn't actually nullify your will, but marriage did. My understanding is here in Ontario that's changed. So again, if you've had big life changes, like a marriage, a separation, a divorce, a spouse passing, really important to go back and double check your wills and plans, because you don't want to leave a great gift to an organization and discover it doesn't go through because something changed. And the other thing I should add, just before we close off today, that's really important. You have a great lawyer, great accountant, great investment person, great insurance person, but if they don't talk, you can run into real challenges. And I had a lady come to a talk that I did for one of the hospitals here in London 4 or 5 years ago. And we discovered that her stockbroker had given her some really great advice around her investment portfolio that was resulting in it bypassing her will. And the idea was to save her tens of thousands of dollars in probate. And on its own, it made sense. but the stockbroker never talked to the lawyer. The lawyer wrote what's called a Henson Trust because she had a disabled adult child, which is something, for example, that many brain tumor families may have, where if you're an ODSP and you inherit too much, you can get kicked out of ODSP. Well, unbeknownst to the stockbroker, the advice that was given here counteracted what the lawyer did, and the kiddo was going to be kicked off as ODSP, all of the support programs, and then on top of it, $1 million charitable gift wasn't going to happen either.
Wow.
All in the attempt to save, $30,000 in probate fees. But if people had talked first, that would have been caught. Unfortunately, I knew the lawyer, I knew the stockbroker. We got them on the phone. It was fixed by 9 the next morning, but it was kind of one of those bullet dodge. So again, really important. The more complicated your scenarios, the more you want to make sure that all your professionals are talking to one another.
Okay. Thank you. Those really, really great tips. Really, really practical tips and information today, Ryan. Thank you so much. And as the others said in the chat, a really great way of presenting the information today. So thank you. And just a few more announcements before we all sign off. So I'm just going to share my screen here for a second. You can turn your video off if you want, Ryan, just for a second. Amazing. Okay, so we did that and we did our questions. And yes, what we'll do also is when we send the recording of the webinar, we'll include some links as well as the web page on our website where we have more information about leaving a legacy and other programs that we have there. And just a reminder that these are the rest of the dates and topics that we're going to be presenting on the rest of the month. So on September 20th is going to be part 1 of Emotions Matter, supporting the mental health of children diagnosed with a brain tumor. So this is specifically going to be for parents and other caregivers. On Tuesday, October 25th, we are going to have a topic around use of tumor treating fields in the management of brain tumors, a Canadian perspective. So anybody who has heard of the treatment called Optune, that's the treatment that we're going to be talking about. And November 22nd, we're going to be talking about inherited factors that predispose to brain cancer. And then December 6th will be part 2 of the September presentation, Emotions Matter Part 2, Mental Health of Caregivers of Children Diagnosed with a Brain Tumor as well. So make sure you register for all of those. And of course, as always, we always record our presentations and send them to anybody who has registered for the presentation. And we're going to do, actually, I'm going to come back to the door prize in a second. The virtual support groups I just want to talk about for a moment. We have a variety of virtual support groups that happen in different time zones for different groups as well. So make sure you do check out our website and the support section, and you can sign up for those virtual support groups as well. And for those of you who did participate in the Brain Tumor Walk weekend back in June, thank you so much. Just so you know, the Brain Tumor Walk website is open all year round, so you can donate to the walk anytime at braintumor.ca. Watch out for registration for 2023 will come out in January as well. And when you sign off of this webinar, the survey is going to pop up. Please just take 2-3 minutes of your time to give us feedback and also to provide us some topics and suggestions for webinar topics for next year. So before we close off, I will do the door prizes, and Ryan has been generous to, he's going to be donating a book as well. So just give me 1 second. I just need to set this up here. We have this fun thing called Wheel of Names. And I will get this set up for us. So we have a couple minutes. If there's anybody else who has any questions for Ryan, you can pop them in the chat section. There we go. Okay, so I'm going to share my screen again. Okay. Full screen. Oh, Leanna Byrne is our first door prize winner. So Leanna, you've won the Brain Tumor Foundation of Canada knapsack. I'm going to remove that. And then the second person who's going to win Ryan's book, Driven by Purpose, is going to go to Jen. So yay to the both of you. Thank you for participating and for showing up. Once again, we really, really appreciate everybody joining us today. and for taking time out of your busy schedules to be part of another Brain Tumor Foundation of Canada webinar. So thank you so much. Please send me any questions or comments to jgoriab@braintumor.ca. And don't forget to sign up for the rest of the webinars this year. And also, once again, if you're interested in presenting it at the Pechekcha event on November 2nd, we're looking for a variety of people from our community to share different stories from their lives. Once again, it can be brain tumor related, but it doesn't have to. And if you go to the Pechekcha website page that Karen shared in the chat, and we'll also share with the email playback, is we as staff members have been doing our own Pechekcha presentation. So you can kind of see what the style is and what it's all about, and also learn a little bit more about the staff here at Brain Tumor Foundation of Canada. So once again, Ryan, thank you so much for joining us today. Really appreciate your time and your expertise and your energy around this. Thank you, everybody, and have a great rest of the day. Take care.